All right. Hello, everyone. My name's Alex Hayward. My pronouns are she, her, hers.
Hi, everyone. My name is Kathleen Cui, and my pronouns are she, her, hers.
And we're here with Vickie Sides, the Director for Education and Outreach in the Office for Sexual Misconduct Prevention and Support, Assistant Dean of Students in the University, and Belinda Vazquez, the Associate Dean of Students in the University for Student Affairs and Director of UChicago Help.
Vickie is responsible for administering the activities and workshops out of the Resources for Sexual Violence Prevention Program Center and uses education, awareness, and activism in service to prevent interpersonal harm and to create a safer campus community. Belinda provides strategic leadership for and coordination of the work of the University Student Emergency Response Systems, including the Dean on Call and Sexual Assault Dean on Call programs, as well as the Bias Education and Support Team.
So first, our question is, can you define unhealthy for us? What does it mean for a relationship or home environment to be unhealthy?
When we think about unhealthy relationships, we're thinking about obviously those that are abusive relationships, right? So those that include things like physical abuse or sexual abuse, but we're also thinking about emotional abuse, and we're thinking about relationships in which people feel threatened or actually are threatened. Sometimes the threat is a threat of homelessness, like I'm going to put you out of the house. Sometimes it's withholding financial support. Right? That happens a lot. Other kinds of intimidation and exploitation. Sometimes it's taking a person's money that they earn or that they have earmarked for school or something, or using up their credit even.
And I think there's also an element of coercive or even toxicity that can occur that can add to unhealthy relationships as well. Things such as coercing individuals to be the go-in-between between an already existing toxic relationship.
Personal space, because we live in a pandemic, and so there are few things we have control over, and one of those things are personal space. And sometimes abuse looks like depriving a person of their personal space or of privacy.
Our next question, which kind of goes off of that, is if you have any advice for how students should prepare to return to these unhealthy home environments that you both have described, and how to approach setting boundaries with one's families or identifying safe places to go if the home environment poses a risk to one's safety.
It is developing a plan. I think what's implied, it's a good question, and it's not an easy one to answer. And the reason why I'm struggling with answering it feels like I might be stalling is because it's really contextually dependent on each person's situation. Knowing who your resources are, who are your confidants in this, right? Who are people you can trust that can hear you out and that can also help you execute a plan. If you're able to, is, maintaining your privacy. Ensure that you only have the password.
How would you recommend that students approach communicating with their support systems about how they are returning to an unhealthy home environment? And whether you have any advice for students who struggle with or are anxious about reaching out to their support systems on this specific topic?
Then this is a go-to, right? Is asking a person, are you open to professional help? That does two things. That sort of destigmatizes this notion of professional help. And it lets them know, like it sort of gives them permission, right, if you will, to look at other resources outside of what it is that you can offer them.
Right now, because of the pandemic, I think a lot of folks are really controlled that they don't want to add burden to the already the feeling of isolation and mental stress that everyone is feeling, right?
Specifically for students who are part of the LGBTQ community, do you have any advice for those who are returning to homophobic, transphobic, or otherwise unwelcoming homes?
The advice to them is around things like that Belinda talked about, things like lining up your resources, safety planning, like sort of having a contingency plan in place, because what we know is that the sort of social factors that lead to increased risk in the world, right? Like homophobia, for example, that increases or gets even more dire in a pandemic.
Wrapping up with resources, what support supports and/or resources does UChicago offer for students who are currently living in an unhealthy home environment or who will return to an unhealthy home environment over Thanksgiving and/or winter break?
I and Belinda too are also sexual assault deans on call. And so that is a 24-hour immediate response that doesn't go to a messaging system or a voicemail or anything. That's like you call, a sexual assault dean on call responds, and they're trained to do crisis intervention so they can move you through that process, help you to move through that process and connect you to resources.
Deans on call are also available.
Yeah.
A lot of times people won't identify themselves as needing, the help of a sexual assault dean on call. We don't want people to get hung up on that. A dean on call can just as easily help as a sexual assault dean on call.
We've talked about safety planning a lot, and just to make it as easy as possible for the viewers of this video, how can a student get the ball rolling with setting up a safety plan with either of you?
So a student can reach out directly to equal opportunity programs. They can reach out directly to me, but probably the best way is to go through the sexual assault team, because that's a 24-hour resource.
The safety app, I would really recommend the safety app because it has the ability to text a sexual assault on call directly. So if none of you who are watching haven't downloaded, or any of you who are watching haven't downloaded yet the safety app, the UChicago Safe app, please do so.
This is such a timely and important conversation. We really appreciate your time and your answers to all our questions. Thank you so much.